My name is Dr. Paul Savage, and I'm the CEO of MDLifespan. Had a patient present to our clinic 6-7 years ago. Her concern was that her family had a very strong history of cancer, and she understood that most cancers that we do preventative screening on women only account for about 40% of the cancers that actually kill women. 60% of the cancer that kill women we never detect until it's late stage. But she came in because she had heard we were offering a new test which tested your blood to look for things related to the cancer, and we could actually detect the cancer much earlier. So we went ahead and did the test on her, and it did come back positive. It came back for ovarian cancer. And we sent her to get imaging studies. It was on her ovary. We sent her to the surgeon. They removed the ovary. They gave the report that she did great, and they said she was cancer-free. So in this case, this is one of the very nice cases that we're able to detect a cancer that would otherwise been catastrophic for her and her family and have a great outcome. The RGCC cancer test is a very simple blood test which looks for different cancer particles. It's easy to do. It can be done at a clinic near you. And once the results come back, which take generally about 4 weeks, we'll get on a virtual call together and go over all that information. Even if it's negative, we'll tell you. Even if it's positive, we'll tell you, and we'll follow up with some options. And depending on your results, our MDLifespan longevity team will work with you and your family to determine the next best steps for you. The brilliance of liquid biopsy is that we can actually determine if you have cancer years before it shows up on traditional radiologic tests or preventative screenings, years beforehand. And when you catch cancer that early, it's a sissy. It's a lot easier to take cancer out, relatively simple, compared to by the time it's grown enough to be stage 4 and it's gotten smart enough to outwit every part of your defense system. Where preventative screenings are pretty much determined for one area, like a mammogram for a breast cancer, or a pap smear for cervical cancer, or PSA for prostate cancer. The beauty about liquid biopsy is it tests for practically every cancer available. If it's going to be able to be seen in your blood, we're going to be able to determine on this test. The exception to this is the brain tumors. Because of the blood-brain barrier, this simple blood test won't work for that. But relatively every other cancer we can detect sooner than later. Cancer is the second leading cause of death. So we recommend that you do this blood biopsy yearly because, as we mentioned, catching cancer early is the best way to defeat it. Let's be serious. We're losing the war of cancer. We've not made progress in 50 years in the treatment of cancer. But the war on cancer won't be won by treatment. The war on cancer will be won by prevention. RGCC Labs, MDLifespan. We're here to give your life more moments.